Hello, and welcome to Frontiers in Health and Happiness, the official podcast of the Lee Kum-shung Center for Health and Happiness at the Harvard T.H. Chan School of Public Health. My name is Ayla Fudala, Center Communications Coordinator, and I'll be asking experts how to live a healthy, happy life. Welcome to the third episode of our Environments for Health and Happiness series, where we explore the complex relationship between the environments we live in and our overall well-being. As urban areas continue to expand and host the majority of the world's population, they become powerful drivers of progress in public health. Today, we'll be discussing the critical role cities play in promoting global health and happiness with renowned urban public health leader Dr. Ivey Boufford. With a career spanning decades, Dr. Boufford has held many important roles, including serving as the president of the New York Academy of Medicine and dean of New York University's Graduate School of Public Service, not to mention serving on our center's scientific advisory board. Her commitment to addressing urban health disparities, fostering interdisciplinary collaboration, and translating evidence into policy has received international recognition. I began by asking Dr. Boufford, what role do cities play in the global economy and global health goals?
Cities are they're the economic drivers of global GDP. I mean, they're probably responsible for 70% of global economic development worldwide, but they're also responsible for the majority of energy consumption and greenhouse gas emissions and solid waste production. So the idea being that unless you deal with the health of cities, you really can't meet global health goals. And so I think the attention to cities is growing for that reason.
Dr. Boufford, what advantages do policymakers working in cities have compared to policymakers working at national or global levels?
That's a very interesting level of governance. I've worked in city government in New York City for a number of years, in different points in my career. And the nice thing about working in cities is if you're a policymaker, you're in an agency, you can announce an initiative, but you can also go out to a neighborhood and see whether it's happening or not. And that's pretty hard to do at national level and certainly almost impossible at global level. So it's quite eye-opening. It's also quite rewarding. But if you get the right political leadership in a city, you can make a lot of change by working across agencies, actively engaging communities, really watching, monitoring your progress and making changes needed.
What role can mayors play in addressing environmental challenges in cities?
Mayors have become super active. They've been very visible at the international COP meetings on environment. I think when President Trump really pulled out, if you will, from those agreements, I think over 200 mayors in the U.S. came together and committed themselves to meeting the goals that had been set by, I think it was COP26 at the time. There's a network of mayors, the UC40 that's working on air pollution, another network of mayors on age-friendly cities. So it's a active group, and they can really sort of design and facilitate change in a way that I think it's much harder at national and global level.
Why is climate change a particularly big issue for cities?
Most big cities are on bodies of water or on the ocean, so climate change and sea level rise are huge issues for cities, protecting against flooding and other issues. There are our climate change colleagues have been identifying something called heat island effect, which is pretty unique to cities where there's a concentration of heat in areas of the city that can be mitigated by planting trees and greens and urban space that increases greenery and water availability. Cities are also really kind of pioneering on the kinds of building materials, strategies for cooling, like painting roofs of buildings white, not putting blacktop in cities, and transportation policy, getting rid of cars. A lot of things that really feed into positive effects on the environment. And again, because they are the locuses of such a large portion of the population, even though they're a kind of small land area in the world, there are a lot of great examples of recycling and addressing energy and addressing climate change and the environment that are going on. So it's a great space to watch if you're interested in environment and climate.
Is loneliness a serious issue in cities?
It's a huge issue. We have a sort of diagram that we use in trying to present the notion of a health in all policies approach for political leaders in cities. And one of the bubbles, there are a bunch of bubbles which represent the sort of major sectors and agencies in in city government. And one of the areas is community engagement and community cohesion. And there's been a lot of, I think, a lot of work in cities really trying to define it. What are the metrics for measuring whether you have it or you don't have it? And I think that's still a challenge in city government for programming. There are a lot of proxy measures, and people are trying to refine them very actively. Public health leadership, and especially people working in cities, are fortunate because communities are so close to really have been developing a lot of strategies for community engagement in problem solving and identifying areas where there is social isolation and failures of communities to create a kind of solidarity and support for each other. And so we're learning a lot in the urban health space about the issue of social isolation and social engagement.
Have you ever done any work in the realm of loneliness?
I'm involved now with the New York State Master Plan on Aging that's very focused on prevention. And one of the really important risk factors for older people is social isolation, partially just in terms of socialization, but also in, being active, being able to get out of their apartments, being able to, stay active and engaged and independent as long as possible. So it's a big theme, and people in the world of aging, there's been a recent study by the U.S. National Academy of Medicine, which developed a global blueprint for healthy longevity to try to sort of begin to approximate years of health with years of life lived, rather than having people sort of in significant portions of longer life not being healthy and active and independent as they wish to be. And so social isolation and engagement is a big theme to address there in terms of the prevention space with older people.
Dr. Boufford, you've worked with companies as well as the government to address public health concerns. Could you tell me about your work with the Novartis Foundation? For those who aren't familiar, the Novartis Foundation is a nonprofit and part of the corporate responsibility portfolio of the Novartis Pharmaceutical Company. The foundation focuses on cardiovascular disease and health inequity across the globe.
The work with the Novartis Foundation began a few years ago. They were interested in addressing upstream risk factors, diminishing them for cardiovascular disease in cities. And so that was obviously a natural connection. And we brought a partnership with the International Society to the work that Novartis was doing with its scientists and program leaders in cities. And their initial work was in low and middle income cities, looking at, I think, especially ways to improve the effectiveness of early identification of cardiovascular disease, prevention, early treatment, and detection and sustaining change. So that was a part of it. But another part that has begun to develop and is going to get to be a bigger part of their work has been looking at the conditions in communities that support or undercut cardiovascular health. And they're now working in so-called data-rich cities, that we're trying to look now at not only the clinical indicators, but also the data from other agencies that, like transportation, urban planning, housing, others that really control the conditions of risk factors that affect cardiovascular disease. So it's a really interesting project. Another company, Novo Nordisk, has been working on a global network called Cities Changing Diabetes. So there are a number of companies that are really looking at cities as a locus for their engagement and supporting programmatic and research efforts to advance health in cities. The other important characteristic, which is indicative, I think, of work many people are doing in cities, is the ability, the necessity and ability to start with government support for what you're doing with the mayors and local authorities, supporting the initiative, and then engaging multiple agencies and the right agencies and officials in that work. And Novartis has been very effective in doing that. We tried to sort of lay that model out in the brief paper that we wrote. And the other piece that they've been really attentive to is the sustainability of change. So making sure that if you're moving out of a city after the project has been done, that there are donors or the governments themselves are going to continue to fund the work. And they've shown great results from that particular work.
You've conducted extensive public health work in Latin America. Can you share some of your experiences?
We at the International Society for Urban Health have had a very positive partnership with a group called Salurbal, Salurbal, which is a regional network of researchers in urban health, researchers and policymakers in urban health that's been developed out of the Drexel School of Public Health in Philadelphia and led by Professor Ana Diaz-Rue for the last 5 years. It was initially supported by the Wellcome Trust, and they are continuing a degree of support, but they have over 300 urban health researchers in most of the countries in Latin America collaborating and really working closely with mayors to implement interventions that have shown to be effective in the urban health space. Latin America has been very advanced in its work on urban planning and active transportation and community engagement in the area of urban health. And so there's a lot to be learned there. And Salurbal is really the best reference point, I think, for people who really want to understand that.
What are the most important factors required to effectively improve urban public health?
I think the most important is having political support for what you want to do. I mean, I think the local government level, many local governments in a number of countries have a good bit of authority. In other countries, they don't. So that's an important variable. But when they do, I think, as I said, mayors are very close to people living and working in cities, and they are quite directly accountable for a lot of the conditions in cities. So getting that political support is really, really crucial. A second feature of effective urban health work is really working across sectors. The public health and healthcare delivery, so-called traditional health sectors, we really have to work very closely with other sectors like urban planning, like built environment, like natural environment, education, economic development, and really create those links to make sure that the policies that are being made and programs that are being developed every day in those sectors are promoting health. For example, in a city, if you are a health promoting transportation policy, you would try to minimize cars, dependency on cars, and maximize mass transit, bike lanes, walking, sidewalks, active transport. And that has huge effects on human health. And then I think the third area that's been really important in promoting urban health has been the degree to which the research enterprise has to be interdisciplinary in teaching. So it's really important for urban health scholars to work with scholars in other disciplines. This is sometimes not supported in the academic environment. Academics are very much in a silo in their own disciplines. And so I think part of working in urban health and urban health research has been kind of challenging those boundaries and promoting interdisciplinary scholarship in the academy, as well as the cross-sectoral work at the city level and the political leadership. You need to connect the dots between evidence to policy to change.
This is my final question. Do you have any recommendations for policymakers looking to make a difference in the world of urban public health?
Policymakers, in my view, would be well advised to try to identify individuals in the academy, in policy think tanks, and others that are doing work in this area, and really make sure that they have good access to not only the evidence that's being developed by academics and researchers, but also that they can inform those academics and researchers about what their problems are, so that those individuals can begin to look at the sort of evidence base to help them solve their own problems. So I think that dialogue with urban policymakers between academia, and if the policymaker happens to be in an intermediary between the academy and think tanks and government, being that bridge is really important, making sure that the movement is in both directions in terms of informing policymakers and political leadership on the evidence for making change, and then making sure that political leaders and policymakers have those partnerships where they can articulate problems they have and the areas in which they need help figuring out what the solutions are.
In our conversation, Dr. Jo Ivey Boufford discussed the ties between urban policy and public health. She emphasized the important role of mayors in making positive changes, such as spearheading environmental initiatives, and shared how cities are making strides in sustainability. Her insights shed light on the pressing issue of loneliness in urban communities and the importance of fostering social connection. Dr. Boufford's experience is a valuable resource, providing guidance for anyone working to build healthier and happier cities. In the 4th episode of our Environments for Health and Happiness series, I'll be sitting down with Dr. Lindsay Burkhart, a practicing pediatrician, chief science officer at the Harvard Center on the Developing Child, and founding director of the center's Early Childhood Scientific Council for Equity and the Environment. We'll explore topics such as the impact of pollution and climate change on children's health, the benefits of exposure to green spaces, and how socioeconomic and environmental factors intersect. Be sure to tune in next time to learn how you can help ensure the next generation's health and happiness. This has been another episode of Frontiers in Health and Happiness, the official podcast of the Lee Kum-Sheung Center for Health and Happiness at the Harvard T.H. Chan School of Public Health. To learn more about upcoming events, visit our website, sign up for our mailing list, and follow us on LinkedIn, X, Instagram, YouTube, and Facebook. New episodes will air every 2 weeks. Episodes can be found on the Lee Kum-Sheung Center for Health and Happiness website and YouTube channel, as well as on Spotify, Apple Podcasts, and wherever else podcasts are found. Thank you for listening.